Well, welcome everybody to today's Ask the Expert session on the late side effects of radiation therapy. We have two lovely speakers with us today, Zoe Walker and Hazel Clarke, who will be answering our questions initially, and if there's anything that you want to bring up at a later stage, they can answer them then. Okay, many of our mums will receive radiotherapy as a routine part of their cancer therapy, and in the whirlwind of having treatment while pregnant or with a new baby, may not take on board the risk of late side effects, which are the symptoms that they might experience. If I could turn to you first, Zoe, could you tell us a bit about the late side effects of radiotherapy to the breast, including the symptoms that our mums might experience, where they can go to get help, and the ways that these symptoms can be managed? I'll then come back and ask if you would have a similar response to those who have received radiotherapy to the brain.
Hello, thank you, Fiona. So my name is Zoe. I'm a late effects radiographer from Bristol. I'm also a mum of two grown-up kids. And today I'm going to talk about, as Fiona said, some radiotherapy late effects for the breast and chest wall, and then we'll follow that with late effects to the brain. So we'll start with, after you've had your radiotherapy treatment to your breast or chest wall, what would you expect? So your consent form is your guide to what you can expect. It's now several pages long, and on the final page, it outlines what the possible late effects from breast or chest wall radiotherapy can be. It states that 10 to 15% of people will get some skin changes, some changes in texture, some changes in size. You might get some possible aching or shooting pains, and even some swelling in the area. It says that less than 10% will get changes in appearance, and these are probably permanent changes in appearance, some swelling, some shoulder stiffness, and maybe lymphedema. And then the rare side effect, the 1%, is something called telangiectasia. And this is a red spider vein type appearance to the skin in the treated area. So it just looks like you've got little broken thread veins all over the area. Now this, I said, is less than 1%, so it's very rare. The good news is that radiotherapy has changed. Over the years, we're really mindful of the fact that people are living longer when cured of their cancer. And so we need to be mindful of the late effects. We don't want people living with problems. And so the planning system and the treatment has changed vastly over the past few years. One of the things that we do for breast and chest wall radiotherapy is that we treat in something called voluntary breath hold. This means that you hold your breath whilst you're having your treatment, particularly for left-sided chest wall or breast treatments. By holding your breath, it moves the breast tissue or the chest wall tissue away from your heart and your lungs. And this means that they get next to no dose, ideally reducing all the late effects that people used to experience with heart toxicity and lung toxicity. If you don't have breath hold, this is because the planning system has told us that your heart and lungs aren't getting any dose, and so you don't need the breath hold. So don't worry if you've had treatment and not been put into breath hold, because that's okay too. We have thought about it. So at my late effects clinic, what kind of side effects do I see? We've gone through them on the consent form, but actually this doesn't necessarily mean you're going to get them. It just is an outline of things that could happen. So the things that I tend to see are breast tenderness or chest wall tenderness, some rib pain or discomfort, and occasionally some lymphedema or arm swelling, or lymphedema and breast swelling. Now, lymphedema is a scary word, and please don't Google it, because if you do, you'll see all sorts of horrible pictures of people with swollen arms and swollen legs. Now, a long time ago, probably 20 years ago, we didn't recognise lymphedema as being a problem. And actually, people just had these arms and legs that swelled, particularly arms with breast radiotherapy, but they had it swelling because of the surgery. The lymph nodes were removed, and then no one did anything about it. They just waited to see whether your arm would swell. Nowadays, we don't wait and see. We've got amazing lymphedema experts that can look at your fingers just as they start to feel a little bit stiff or slightly swollen, And this is what I see in my clinic. I see ladies and gentlemen that come to me that have got slight swelling in their fingers. And at this point, we identify that maybe they've got some lymphedema. We have some clever gadgets that can measure whether you've got tissue fluid in your arms. And what we can do is then refer you to the lymphedema service, whilst giving you some simple massage techniques and compression garments to help manage the problem. If we get on top of it early, it's never going to cause you any of those horrible pictures that you see on the internet. Actually, you might even not even feel that you have a problem. It's just that we need to keep on top of it early. So don't be scared by lymphedema. It's perfectly something we can manage really easily with simple massage and compression garments. But we do need you to tell people like me or like your GP that you think you might have a problem early on. Remember, on the consent form, it said that less than 10% get this problem. And nowadays, because we know very rarely treat the lymph nodes in your armpit, or surgeons don't remove all of them, they will just remove one or two. The problems with arm lymphedema have reduced dramatically, thankfully. So those horrible pictures that you sometimes see, you don't need to worry about so much. The other problems that people come to my clinic with is pain, and this is pain in their breast and pain in their ribs. Now, unfortunately, when you have radiotherapy, sometimes after a long time, you get this stiffness of your tissue. So your breast tissue feels stiff and the tissue around your ribs can feel stiff. This is something that we call fibrosis. And what happens is, if you think of a sausage and you think of cooking a sausage, it goes from soft to firm. This is a little bit what happens in the tissues in your breast and around your ribs. Now, pain is one of those things that often when you get pain, you worry. You worry that it's recurrence, or you worry that something coming back. And we can, by seeing your surgeon, your breast care nurse, or us, we can carry out the correct test to reassure you that these isn't a recurrence. It's just due to this fibrotic tissue. But it's very important that you get things investigated. And that's one of our jobs at the Late Effects Clinic, is to investigate all possibilities and then look at treatment. So for fibrosis, there's lots of simple things that we can do. One of the loveliest things is yoga. So stretching, trying to get the tissues that are in your breast and around your chest wall and your ribs moving again. So just freeing them up. So by doing simple breathing exercises, and sometimes we use a contraction called a spirometer, where you breathe into it and it allows your lungs to expand and contract. Simple things like this will just free up the tissue and therefore make things much more comfortable. Photolight therapy is something else that we can use, and it's a bit like a cross between a shower head and an ultrasound machine. And it just allows you to put a little bit of light therapy through the tissues. This softens them up a bit and hopefully reduces the pain by reducing the stiffness. Simple massage again, heat pads, cooling pads, whatever feels comfortable for you. But these simple changes can actually make a massive difference to the stiffness of the tissues and therefore consequently reducing the pain. Often people have been living with pain for a few months, sometimes a year. And actually, the more pain you have, the less you move. So the less you move, the worse your pain gets. And so by encouraging people to do simple yoga, simple exercises, simple inhalation, exhalation exercises, it works miracles. And all of a sudden you start freeing up those tissues and reducing the pain, which is amazing and very simple techniques. The good thing about Late Effects is that we want to keep the techniques simple, things you can do at home and things you can do yourself. You don't want to be trekking up to the hospital every day to go for treatment. You want things that you can manage yourself and fit into your everyday lifestyle. And so that's why massage and simple breathing exercises work brilliantly. If you're at all worried about lymphedema, please ask for a referral to the lymphedema service. Every region has a really good lymphedema service now, and early diagnosis is the key. Again, simple massage of your arm, your armpit, or your chest breast area can help reduce lymphedema dramatically. Things like breast swelling, if you just wear a sports bra, actually to keep everything tight and compressed, actually can reduce the fluid. And as we all know, when you get swollen breasts, they're tender and they're painful. By keeping them well supported and your underwear tight, this can improve the pain and discomfort. So sometimes the simple things are the best things. I think the key with all aspects of skin and skin changes is continue with the moisturizing and the massage that you did when you were having treatment. You can use any moisturizer, it doesn't matter what you use, but just keep it up. Keeping the skin soft and supple will always benefit, and having radiotherapy does dry your skin out. So by adding moisture back in, and the process of the massage will always improve the texture and the feeling of the breast or chest wall tissue after it's been irradiated. I mentioned the very rare side effect of telangiectasia and this thread veins, and even that, although not very common nowadays, probably people that had treatment 20 to 25 years ago on something called a cobalt machine, opposed to the linear accelerators that we use nowadays, got this kind of treatment. And they ended up with this thread vein-like appearance. Even that now can be treated using laser treatment, a bit like you would treat a scar or a birthmark. And we can laser the tissue to reduce the appearance of these thread veins. So the cosmetics result is much better. With fibrotic tissue, moisturizing, massage will soften it up and improve the appearance. And again, some of the light therapy and laser therapy has been tested and used to break down this fibrotic tissue and improve the appearance and softness. Overall, the good news is I think that radiotherapy now is very much honed into reducing the late effects to the breast and chest wall tissue. We only treat the tissue that we need to treat. We don't treat axillary lymph nodes if we don't need to. We're very knowledgeable about things like the brachial plexus and the nerves that feed your arm. And there was some stories in the press previously about nerve damage. But again, we're very aware of this now. Those kind of things we are mindful when we're planning your treatment, that these things, we don't want them to happen. So the simple things like pain and discomfort, we can treat, we can help you with. There are things we can be done about it. So don't just sit there thinking my breast feels a bit swollen and a bit painful after treatment. Seek help, because there are simple things we can do to make things better. Thank you. I will go on now to talk about the late effects of brain radiotherapy, which is a very different subject to breast radiotherapy, but also along the same lines of having an impact on your quality of life. So brain radiotherapy is very, very precise. Unlike some radiotherapy, we tend to only treat the small area of the brain that is affected by your cancer diagnosis. We look very carefully at the areas around it that we're treating, and often you'll be held very still in a very precise brain jig that will stop you from any kind of motion or movement. So you needn't be worried about other things that are being treated. We often look at the ideas of what brain radiotherapy is and why we are irradiating brain tissue. And the side effects of brain tissue irradiation often lead to brain fog and fatigue. The brain tumor charity is a font of all sorts of information on brain fog and brain fatigue. Cancer-related fatigue is a recognized symptom, but particularly with brain radiotherapy, we find people have chemotherapy and steroid treatment also leading to this increased brain fog and brain fatigue. So what are we going to do about it? The Brain Tumor Charity comes up with a lot of guidelines about pacing for fatigue. And fatigue services are available again throughout the country. You just need to ask for help. Our local fatigue services put into place a lot of help and support with pacing and acknowledging boom and bust techniques. So looking at overdoing it one day and then feeling exhausted the next day. With brain cancer treatment, often this is one of the main problems, is you want to function as though you functioned before, and actually you feel like you're wading through mud. So what are we going to do about it? Some of the guidelines suggest by battling fatigue, we will improve brain fog. The two are very linked. So what we need to do is look at our battery and how we're going to charge it or recharge it, and be mindful of pacing ourselves from day to day. So we look at what are we doing one day and what are we doing the next. As a mum, we have small children or big children. They're exhausting. We have a lot to do. And so trying to have a day where you get to rest is probably often not an easy option. So what are we going to do about it? Well, actually, what we're going to do is try and find events or stuff that is less draining for us. We're going to try and make our life consciously planned so that we have times where we have a little bit of downtime, and so that we can allow ourselves to recharge. Fatigue services are great, and the National Fatigue Service, based in Bath, run courses to allow you to look at your lifestyle and the adaptations that you need to make to try and help yourself reduce your fatigue and the impact that it has on your life. Brain fog is an interesting one, and the National Brain Tumour Charity has a load of crosswords, word searches, simple things like spot the difference, but help with your cognitive impairment. They also have a whole load of things to help planning your daily activities. So they have diaries, they have memos, they show you how to use your phone to do reminders, they tell you to use post-its, but they have loads of little hints and tips on how to manage the fact that you don't feel your brain is functioning like it should. So these hints and tips are brilliant, and it's well worth having a look. But again, if you came to a late effects clinic, that's the kind of thing we would go through. We would look at your life, we'd look at little prompts and helpful hints and tips that you can use to make your life a bit easier. And easy is good, because if you have to work less hard at functioning on a day-to-day basis, you will be less tired. But equally, if you're very tired, we know, or fatigued, we know that functioning, your brain will work much slower. So I think the important thing with post-brain radiotherapy is that you need to ask for help. You need to acknowledge the fact that things are a bit harder work, and sometimes it's not directly to do with the radiotherapy, it's to do with the chemotherapy you've had and the steroids, but it's all linked, and it's all important that you ask for help, and we look at these hints and tips on how to make things that little bit better. If we've treated anywhere near your eyes, I did mention that one of the late effects is dry eye. And again, easily managed by any kind of eye drops. But if you start to notice that your eyes feel a little bit dry or a little bit gritty, it's important that you use them regularly. Often your GP can prescribe them, but you can also ask your oncologist, your CNS. They're all very able to provide information on these kind of simple treatments. I think the important thing about brain radiotherapy is to acknowledge the fact that it is the treatment that is making you feel tired, and it is the treatment that is making you feel like you have this brain fog, and that not to fight it, but almost to accept it and embrace it, but then learn simple ways to manage it. And at the Late Effects Clinic, we could help you do that, along with the support of charities like the Brain Tumour Charity. Thank you.
Thanks, Zoe. That was really great. That was really useful. Another site where our mums may be given radiotherapy as part of the treatment of their cancer is the pelvis. Hazel, I wonder if you could talk us through the potential late effects in this region and what treatments are available.
Late effects radiographer at Bath. So as Zoe said previously, the consent form is really useful to refer back to. It goes through all the potential different things that might happen. So if you are concerned that something's going on, it might be linked to your treatment, then definitely refer back to that. So the main really common late effects from pelvic treatment are bowel problems and urinary problems. So in terms of bowel problems, it's always really important to highlight any change of bowel habit or any bleeding from the bottom to your GP in the first instance. This is just so that we can rule out any other causes before we sort of land on the radiotherapy late effects. So in terms of ruling that out, often you might get sent for a colonoscopy, which isn't always the nicest thing to go for, but it's a really good way of just checking that there's nothing else there that we need to worry about. And also that colonoscopy can identify if there's any radiation damage in the bowel. So it's quite a good starting point. We know that there's nothing to worry, not nothing to worry about, but nothing sinister to worry about. And then we can start working on how we manage the symptom. So once we've done that and we're happy, so then come along to the late effects clinic and we'll work with, we've got lots of different strategies. So in terms of managing bowel problems, it's not really a one size fits all. We've got lots of different things that we'll discuss with you, look at your lifestyle, look at what your symptoms are, and we'll tailor that to what you need. So these can be things like dietary changes. We can maybe do a food diary, see if there's any sort of triggers. Often these symptoms are quite similar to IBS, so the management can be quite similar. It might be that certain spicy foods or certain certain things, sometimes people can become a little bit lactose intolerant after radiotherapy. Sometimes high fat diets can be a bit of a trigger, but it's quite individual. So we will, rather than sort of saying you must cut out X, Y and Z, we will talk to you, work out what your diet is. You know, it may be that you're vegan, vegetarian, have certain allergies, so we don't want to just say you have to do this. We'll work with you and discuss what fits in best with you, what you can manage, that sort of thing. We'll often look at increasing soluble fibre in your diet. So in times gone by, we tended to get people to reduce the amount of fibre if they were suffering with diarrhea. But actually the evidence now is that a higher fibre diet is much better to manage bowel problems. Soluble fibre is the one we want to look at increasing, really. So you've got soluble and insoluble fibre. Soluble fibre will dissolve into a gel in your gut and just gently push everything through, whereas the insoluble fibre is the roughage that can be a little bit tricky on your system. So we'll talk about things like that and ways that you can increase that. Sometimes that's as simple as having a tablespoon of linseeds with your porridge, and that's all you need to do, and that can really make a big difference to your gut transit. Also probiotics can be really helpful. It's still sort of quite emerging in terms of evidence as to what they do, but we think that the microbiome in your gut, so all the healthy bacteria and sort of microorganisms and that sort of thing that contribute to a healthy gut and just general health, that can be affected when we treat the pelvis with radiotherapy. So if we can start building that microbiome back up with probiotics and certain foods that introduce that bacteria back in, that could be really beneficial. And I do find that after about a month or so of people taking the probiotics, which can be just the little Actimel drinks, or the supermarkets all do their own, or capsule form, whatever works best for you, it can make quite a big difference to people, and it's a really easy thing that people can put into their daily routine. So that's something that we tend to suggest with most people. We'll also look at certain medications to use to manage it. So what we tend to find in terms of bowel problems, people will swing between diarrhea and constipation, and they can't get that happy medium. So we'll introduce an antidiarrheal, such as Imodium, and also a laxative, which sounds counterproductive because they're doing different things, but actually they work together to just, again, settle that bowel down and get you into a normal rhythm. And these, we tend to do this in a very low dose regime and in a regular fashion. So 1 tablet a day, 1 sachet a day, again, quite easy to fit in with your normal routine and can make quite a big difference. this is the one that we tend to tweak a little bit depending on the symptoms. So sometimes people won't have the antidiarrheal, they'll just have the laxative, or vice versa, or they might have a little bit more of one. And then there's always scope to kind of play around with the dose, because we're working with such low dose margins. So we'll discuss all of that, and certain people might feel if they're traveling they might want to take a bit more Imodium, or not take the laxative, and we can discuss all of that and sort of work out how it works best with people's lifestyles. We can also talk about sort of planning your day, so things like working out where public toilets are if you're out and about, if you're going somewhere new. There's various apps that can help with that. We can help you get a radar key, which gives access to disabled toilets to make it a bit easier when you're out and about. And also a few charities, so Macmillan and Prostate Cancer UK and Joe's Trust, I think, all provide these little toilet cards which allow you just to flash in a pub or a shop just to say, can I use your toilet, without you having to explain the whole thing. And often it makes it quite clear what the issue is without, you know, it being embarrassing. And they generally do work quite well and give people peace of mind just to have in their pocket or their wallet. So we'll sort of talk about practical things, that sort of thing. It's important to note that some of these bowel changes or the interventions aren't going to cure the problem, but they are going to help manage it. So you might still have the odd bad day, and try not to get too worried about that. We're always on the end of the phone to help if you're concerned, but there is like the likelihood that occasionally these things might come back, and we can always just discuss sort of how we tweak things to manage that. But it hopefully will be much more manageable than without these interventions. If these interventions that we put into place don't help, then we've got links with gastroenterology, so we can refer on to more specialist services if we need to, if we're concerned. But a lot of these things we can put in place while you're waiting for that specialist referral and give you support while you're waiting. Urinary symptoms can be another issue that sort of comes hand in hand with the bowel symptoms. We will have a look at what you're drinking in the first instance, make sure that you're drinking the right things or not too much of the wrong things. Again, we'll work with you. We're not going to sort of militantly say you can't have this, you can't have that, but we'll discuss the reasoning behind some of the information we give you, and work out how you can sort of change these things in line with what works for you. We'll also look at pelvic floor exercises, which often, when we speak to some of the men in clinic, they kind of go, what? Women are a bit more familiar with, but we can give written information with regards to that. There's various apps that are around to help, but also we can refer on to specialist physiotherapists, bowel and bladder services that can give a bit more intensive support. And then again, we can speak to urology. We've got links with them. So if there's certain things that they can offer, sometimes there's some medications that urology will offer to help with urinary incontinence and some treatments. So we will discuss with them depending on what's needed. But as a baseline, we'll sort of look at fluid to start with, look at pelvic floor exercises, and often that's that can go quite a long way in managing those symptoms. So in terms of vaginal symptoms, obviously that gets caught up with the radiotherapy as well. So a lot of ladies can get some shortening of the vagina, drying and narrowing. This makes sex uncomfortable. So like Zoe was talking about with the fibrosis in the breast, the same thing can happen in the vagina. So most people now should have been given dilators while they were on treatment. Hopefully the NHS standard issue ones aren't great, but they do the job. So basically we're wanting to stretch that tissue. The vagina normally will sit flat like that rather than a tube, and then when it's in use it opens up. So the use of the vagina of the dilator is that it's stretching that tissue, as Zoe said, just to keep it sort of stretchy and elastic like it should be, because the risk is that it starts to harden up after treatment. We can help with providing vaginal moisturizers and lubricants, which can make a big difference when to make sex a bit more comfortable. And then also we've got devices such as O-nuts, which I meant to have with me but I haven't to show you, but they go around the penis to reduce the depth of penetration. So if women are experienced vaginal shortening and it's uncomfortable during sex, then this just limits how far the penis can go in, so it can make things a bit more comfortable. And we can just talk around the logistics of that. Often when women come to the late effects clinic, sex is the first thing from their mind, so we can have a talk about how that sort of intimacy can be reintroduced if that's what they want to, if they want to do that, is what they want to do. And often it's not something that gets talked about by some of the other health professionals, so we do try and raise the subject, so we are somebody that you can talk to about that sort of thing if needed. So radiotherapy to the pelvis, depending on what we're treating, where we're treating, can also lead to infertility and early menopause. So it's important to discuss that prior to treatment, and the oncologist will raise that issue to see if there's any fertility sparing that needs to happen, any egg freezing, that sort of thing. And then in terms of early menopause, it's really important to seek help. Again, it should be put in place, but if not, we can help with that. GPs are becoming more knowledgeable at managing symptoms of menopause, and there's also more specialist clinics in the hospital setting now, so not as many as we would like, but it is something that we're doing some work around to support women with those menopausal symptoms. And then we can also, in the late effects clinic, we can help with lifestyle changes, supplements, that sort of thing, and then refer on to these clinics to help and the GPs to help with potential HRT if appropriate. But it's something that we can discuss. In terms of support available, the pelvic radiation disease is a really, really useful resource. So they are a charity specifically to help people going through that have had radiotherapy to the pelvis and are going through these symptoms, which we sort of class as pelvic radiation disease. They've got a raft of information on their website. You can also get those radar keys that I mentioned from them. They've done an awful lot of work around supporting people, so I would definitely encourage you to look at that. Also, Joe's Trust is a website, is a charity to support ladies who've had gynae cancer. So their website has got quite a lot of information about pelvic radiation disease and support as well. So yeah, I would encourage you to go and have a look at those. Fatigue, as Zoe mentioned, is kind of across the board with a lot of the things that we're that we're dealing with, but it again is present with people that have had pelvic radiation. So again, we'll look at some of the strategies Zoe said about managing the boom and bust kind of cycles, looking at your battery, and then refer to specialist services if needed. I've got a really nice oncology therapies team who will look at exercise and fatigue management for me, and then also as I also work at Bath, that's where the National Centre for Fatigue is based, so we'll link in with them as well. So if fatigue is an issue that people are struggling with, then that's something that we can help with as well. So yeah,
that's great. Thank you very much, Hazel. That was very helpful. Our final question today, many of our mums find that the onset of late radiotherapy side effects come at a time when they have maybe passed the worst of their cancer journey. So it comes as quite a distressing symptom, if you like, when they felt that things are getting better. Is there any psychological support available, either directly through long-term radiotherapy clinics, or any other networks that can link mums that are going through a similar situation?
Yeah, so there is lots of support out there, but mental health support across the board isn't as prolific as we like. So it can depend on whereabouts you are. So all late effect staff and the clinical nurse specialists should be trained with what we call psychological skills level 2, which gives us an element of being able to support you in the first instance. So we can talk things through, we can give pointers, but obviously we're not trained counsellors, psychologists, but we have a level of support that we can offer. And then in my trust, we've got specialist oncology psychologists, which I'm lucky enough to be able to refer any of my patients in indefinitely. This isn't the case across the board. I know Zoe, I think, has a time limit of how long someone's been out of treatment, so it could be a bit more difficult, but they're depending on where you are, definitely ask in that trust and see what they've got available, because it might be that you've got these specialist psychologists available. And as I mentioned before, we've got this specialist oncology therapies team, so they will also give mindfulness support to some of the patients that maybe don't feel that they need a psychologist, but they need a bit of something that they can do for themselves. So they can be really supportive there. Bupa have counselling services that they run through Macmillan. So if you ring the Macmillan number, there's a generic one number for Macmillan, and ask to be referred to the Bupa counselling service. I think it's either 6 or 8 sessions that are free. It is all over the phone, but it's with a qualified psychotherapist who will, and obviously is working from an oncology sort of perspective. So that's a really useful resource, and as I said, all free, so really good to access. In terms of sort of quality, it's not means tested or anything, it's just if you've been through cancer, you can access that through Macmillan. So that's really, really good. Most areas will have local charities who provide talking therapy. So we've got one locally called We Hear You. I think Zoe's is called Vitamines. There should be across the country, hopefully, a lot more of these. So it's working out what, asking staff what the contacts are for these charities. Then at a lower level, in the community, there's services called IAPT services, which are through the GP. So these are general psychological support, they're not oncology specific, but depending on the level that's required, that might be something that's helpful. I believe it's group sessions as well, so it depends what, if that's suitable. I mentioned about sometimes if people have had to freeze their eggs, those companies that have done the egg freezing should also offer psychological support. So going back to them and finding out what they offer quite specifically to that area would be good. So the charities that we've mentioned as well, the PRDA Joe's Trust will have support groups and chat rooms through their website. So some people can find that quite helpful. Equally, sometimes people find them a bit overwhelming, so just just go with what you're comfortable with, and then there should be some local in-person support groups. So we've got a really good local charity called We Get It, who just meet up on a Friday morning. It's all different cancer types and different stages of treatment or recovery, just to talk things through. And then they also do some challenges and things to raise money, but that's not obligatory, but there'll be similar things in your local vicinity. The main thing is it's important to ask. A lot of people will maybe feel embarrassed or feel that they're the only one struggling with the psychological impact, but nobody will have gone through a cancer journey and not had some sort of psychological impact. It's a huge thing. So getting the right support is really important, but as I said, because things are so different regionally, you need to ask your healthcare professionals to put you in the right direction, and then but hopefully you should have a raft of different things that are at different levels, and there's something that you can access that's the right thing for you. But yeah, just don't suffer in silence. You're not alone at all. It's very normal to feel, particularly after treatment, to struggle psychologically, and we're here to support you through the Late Effects Clinic. So just yeah, talk to us, really.
Okay, that's great. Thanks very much, Hazel. That sort of concludes our session today. So I thank you both, Zoe and Hazel, for joining us.
Thank you.